Welcome back to Wichita's Biz That Is, and our guest today, Ann Nelson of the Central Plains Healthcare Partnership. Much has changed with the Affordable Care Act. Sort of, where are we now? What has happened? Some people were supposed to be covered who weren't covered before. Kind of what's occurred?
The Affordable Care Act implementation looks very different state to state. So let's talk about Kansas. One significant piece of the Affordable Care Act was to expand Medicaid and cover a significant population of people who weren't eligible before in Medicaid. Now, Medicaid in Kansas is called CanCare, so that might sound familiar to some of your viewers. We are not expanding Medicaid in Kansas. 72% of the patient population that we serve here in Wichita would be eligible for an expanded Medicaid program, but they remain uninsured. We, in our own program, at the first enrollment period last year, during that enrollment period, we enrolled 100 people. We helped them navigate through the marketplace, the Affordable Care Act marketplace, got them new insurance, and they were able to have coverage, so we didn't need to serve them through Project Access anymore. We're currently doing that. We've cast a net through our patient population to see which of our patient population would be eligible for subsidies within the marketplace. And we're asking them to come in, we navigate them through a computer system and get them enrolled. We don't have numbers right now, but we're hoping that a significant number will.
Well, it's been interesting. We have a navigator. Navigator was part of the Affordable Care Act. It's a person to take folks who typically haven't had coverage and sort of work them through what's on that exchange. Show them what's there, they're not involved in selling anything. They don't make any money off of it.
No.
And we have one. And this month, I think, by the time we recorded this, she'd talked to help 14 people. The majority of those, large majority, didn't qualify. Even though many of them are pretty poor, you would think maybe they would.
They would possibly qualify for Medicaid if we had expanded it. You know, through the lifetime of the Project Access program, we've served 12,440 people and leveraged $170 million in donated care. I would love for every one of those persons to have coverage. Having coverage is best for individuals, their families, their businesses. This is a workforce issue, too.
Well, I understand that. There are costs in this whole thing. And we had been close with the Iowa-Nebraska partnership, or co-op. And they went belly up. And the reason they went belly up is they got so many people who had been on the high-risk pool or uninsured, and their claims were too great.
Well, what happened, I think, in part is that they expanded Medicaid last year in Iowa, and that cooperative got a significant number of chronically ill, chronically poor, chronically uninsured
Ask us. WEBA knows all about that.
Yes.
that killed our plan.
And I think what could have made the difference is really good care management and social management of people.
Let's talk a little about care management. We've got the time.
Sure.
What does that mean? What's the difference? I mean, it used to be, when I was a kid, you didn't have insurance. You went to the doctor when you got sick. Thank you very much.
You gave them a chicken or paid the bill.
Right.
Whatever that looks like in a rural area or in a city.
I'm sorry, you wouldn't know about that. You're too young. But
well, no, I wouldn't, actually. My father was a physician. While I was growing up, he was an anesthesiologist. So I got to see the inside of the healthcare system growing up. And
back to the patient care.
Okay. If you've ever had a health condition and had to call physician offices and navigate through a very, very confusing healthcare system, you understand that it can be quite difficult. You don't know what to do. Your insurance plan is very confusing. You get documents that are mailed to you. What does this mean? Care management is an individual or a group of people that identify patient populations who might be in a position to accept some assistance, some help navigating through the healthcare system, some patient education. What does diabetes mean? How do I check my blood sugar? What's an A1C?
Let me interrupt for a sec. There are a couple of benefits here. One, you're targeting folks who probably have conditions that need to be dealt with.
Yes.
So you can improve their care.
Yes.
Two, it improves the cost because the current problem is people may not be taking medicines they should be taking,
They usually aren't.
or taking actions they should be
Yes.
taken to make themselves better.
So essentially, care management facilitates people becoming more responsible for managing their own health conditions.
And part of what we're
that's
talking
important.
about here is, there's been a passivity in our system.
Yes.
The employer pays, the employee often doesn't give the employer any credit for it.
No.
And it's sort of like, yeah, well, when I get this, I'll go to the doc. But part of what we're after these days is not, we're after people being healthier.
Prevention, yes.
So the prevention is a big deal. I remember doing a study on fires when I first went to work in government, and I learned that the suppression was nice, but it really didn't affect very much. It was all prevention.
Don't let the fire start.
Exactly. And when we did that, we cut the fires to a third of what they'd been.
Saving a lot of lives. Well,
And-
that's what
and
they're
value.
That's what we're trying to do in healthcare.
Right.
Identify people early when they have chronic conditions starting, help them be responsible at home in between those physician appointments, and I think educating the medical community about how to better navigate and manage their patient populations.
I think we should tell people how to get a hold of the Central Plains Partnership and Project Access.
We would love phone calls and questions. You can visit our website first, which is www.cphcp.com, Central Plains.
Did you get all that,
Healthcare.
folks?
cphcp.com, 688-0600.
Okay. And we'll have some other things we can do on that, but I want to thank you, and Wichita's lucky to have Ann Nelson around.
Thank
She's
you.
done a wonderful job for us, and we thank you, and thanks for being here on Wichita's Biz That Is.
Thank you so much.